Hi, I'm Dr. Bob Neff, and we're here at Fairfield Equine Associates, an equine or horse hospital in Newtown, Connecticut. Today we are going to be going inside to take a tour of our facility, where you'll get an opportunity to see the doctors, technicians, and office staff that help to take care of your horse should it need to come into our hospital. So please come with me and we'll go on a tour. So this is the office. This is our reception area where phone calls come in, appointments are made, emergency calls are taken, and all of your horse's records are kept. Everything is kept on computer systems and paper files as well. So let's move on. Down here we have our conference room. Here's where we meet with our doctors to discuss cases. We also meet with clients to talk about their patients and talk about what we need to do with them. Also, clients can stay in here while their horse is having surgery and be able to view their horse on the table if they would like. So this is the laboratory. Over here we have an autoclave. This is what we use to sterilize instruments. It's very important that instruments be very clean and sterile when they're used on horses for surgery. Also in this area we process blood that we take from our patients either in the hospital or out in the field. Over here we're able to do just some basic blood work, CBC chemistry, that just kind of tells you a little bit about your horse. A lot of other blood work we send out to universities and other companies to get more specific tests done. Over here we have something really cool. This is some of the latest in technology that we're using on the horses. It's IRAP and PRP. And basically what we do is we take a blood sample from your horse and we spin it down and draw out very special portions of the blood work, and then we inject it back into your horse. And what this does is it helps to treat conditions that affect their soft tissues, their tendons, their joints, and it helps to decrease inflammation and make them healthy again. Here we have an old-fashioned viewing box. This is what we used to put radiographs up on to look at them and study them. But now with digital radiography, most of what we do is on the computer. If we did have an old-fashioned radiograph to look at, this is where we would do it. Now come this way, I want to introduce you to one of the oldest members of the group. Meet Mrs. Bones. Mrs. Bones is a real horse skeleton that we have here at the practice to help demonstrate to our clients the different regions of the body and what's being affected. And we also use it as a helpful aid for the doctors when they're trying to figure out where a problem is and to figure out a therapy. Now, I mentioned that her name is Mrs. Bones. How do I know that it's Mrs. Bones and not Mr. Bones? It all has to do with the skeleton and her tooth structure. Male horses have canine teeth, which would be located here and here. As you can see, there are no canine teeth on this horse, and so therefore it's Mrs. Bones. Okay, next up, let's go to the pharmacy. So this is our pharmacy. When you get sick and you have a prescription, you need to go down to the local pharmacy and pick up your medications. Here at our hospital, we keep everything in stock so that we're able to take care of our animals in our hospital and also to stock our trucks that go out in the field to take care of horses out at the farms. Now, let's head out and I'll show you some more of the hospital. So this is our area where we take care of our digital radiography. Back in the other room, I showed you the board where we looked at old-fashioned films. This is the new way to do it. These are computerized systems. This is a station that allows us to take radiographs. And this is a station where we look at the radiographs and we archive and put all of our pictures up on this unit. We also are able to take radiographs right here and view them immediately up on this screen. That's what's so cool about these systems, is that you no longer have to wait. They're there like that. All right, now we'll head over to the nuclear scintigraphy. Okay, so this is nuclear scintigraphy. This is another really cool diagnostic tool that we have to try and figure out what's wrong with the horses. We put a catheter into their vein and we inject a radioisotope into their vein, which spreads through their whole body, and it goes in particular to the bones. Then, after about 3 hours, we bring them in and we stand them right in front of this camera. This is basically, it's a giant Geiger counter. And the horse stands in front of it, and we're able to adjust the machine up and down. We can go up, we can slide it left and right, we can rotate the camera, and we can take images of their entire body. And in the end, what it's looking at is the radiation counts coming from their bones. So if there's an area that's injured, it shows up as a really dark hot spot. And then from there, we're able to go ahead and treat those areas. All right, so now I'm going to take you out and show you some of our other therapeutic areas. Okay, so this is another area where we do diagnostics and also therapies. This is a set of stocks. It is an area where we can load the horse, put the horse in here, and it protects both the horse and the doctors that are working on them. We put them in here to do numerous procedures. We can do ultrasounds, gastroscopies, and we can also do injection therapies as needed. This is one of the diagnostics that we use when the horses are in the stocks. This is called a gastroscope, and it's a very long video endoscope that we can put up their nose, down their esophagus, and into their stomach. And as you can see, it's a camera on the end of the scope. And we're able to see the inside of their stomach, so we can look for ulcers, which are very common in horses, especially that do a lot of showing. And if we diagnose ulcers, then we can prescribe the appropriate medicine that's necessary to make them better. Another diagnostic that we have is ultrasound. Many of you kids have probably seen these before if you've ever seen your mom get an ultrasound for pregnancy. This is the same type of machine. We can use this on just about any area of the horse's body, head, neck, legs, anywhere we want to. Again, they've gotten very small, and so they're very portable. So we take these out in the field with us as well. So that pretty much wraps up the diagnostics part of it. Now I'm going to take you to the centerpiece of the practice, which is our surgery room. Okay, so this is where the surgery process begins. This is where the doctors come in to scrub and prepare to do surgery. We talked about before how important sterility and cleanliness is. Well, here we have a sink where the surgeons scrub up, and then they move into the surgery room and they gown up for surgery. While that's all going on, the patient is brought into this room, which is called an induction and recovery stall. They're brought in, as you can see, the walls are heavily padded. This is for their protection. And they are brought in up against that wall. They're given a sedative so that they're nice and calm. And then they are given the anesthetic. And a crew of people are used to lower them down the wall and lay them on the floor. A tube is then put into their tracheas to help them breathe during surgery. And we then bring in the hoist to move the patient into the surgery room. Each of their legs is placed into the straps, and they are brought by this overhead trolley system in and lowered down onto the surgery table. Once on the table, their legs are secured to these arms, and the horse is then prepped for whatever surgery it is that we might be doing. It could be a colic surgery, it could be a neurectomy. There are any number of surgical procedures that we can do. There is a crew of people involved in doing one of these surgeries. There are 1 to 2 surgeons. There's an anesthesiologist who monitors the patient through the entire procedure. And then there are at least 2 technicians that help to set up the room, prepare the horse, and help the doctors get gowned and complete the surgeries. Over here is the anesthesia machine, and this is a crucial element of the surgery as well. This is where the monitoring of the patient takes place, and the anesthetic gas is used to keep the horse asleep while the procedure is taking place. Over there we have an EKG machine, which is used to monitor their heart, and a cart that contains all the medications that are necessary to keep the horse asleep during the procedure. Once the surgery is completed, the horse is then attached back to the hoist and lifted off of the table, moved on the monorail system over to the recovery stall. Here they are lowered onto the floor and they are monitored during the recovery period. Now, this can take anywhere from a half an hour up to a couple of hours. The horse is monitored very closely, and as they slowly wake up from anesthesia, they will attempt to get up. Once they've recovered enough and they're stable, we then move them to their stall in the hospital, and that will be our next stop. Okay, so this is our hospital. In hospitals, there are rooms where the patients stay. For a horse hospital, those are stalls. In our hospital, we have 12 stalls that we're able to keep our patients, and those patients can range anywhere from patients that just come in for the day to those that are here for lameness workups and further treatments, to the horses that come out of surgery and need to recover further out here in the stalls. Down this way, we have a very special stall. This is a padded stall, much like the recovery and induction stalls that you saw in the surgery room, for horses that may have difficulty standing or getting up. During surgery, if they just don't recover quite as quickly, we can pick them up and we can move them all the way over to this side, to the barn, put them down on the floor, close the door again, and then help them to recover. We're also able to put a sling system up for horses that still have trouble standing up so that we can allow them to hang and finally get their strength and stand on their own. Now, we talked before about how important cleanliness is. You'll notice that the floors are swept and very, very clean. This is probably the cleanest barn you will ever be in. The stalls themselves are also kept very, very clean. The shavings are picked out constantly all day long so that the horses are in a very clean environment, which is very important, especially for horses that have come out of surgery. Every stall is also equipped with fluid hangers. These are hooks that are suspended from the ceiling that allow us to hang fluids and other therapies such as antibiotics, plasma, and other things that they may need to get intravenously. Now, you might be asking, why are the fluid hangers so high? Well, you have to remember that the horses are very big animals, and we need to be able to get the fluids to drop by gravity down into their bodies. So that's why it's necessary for them to be as high as they are. Well, that's how we take care of our horses. Well, that wraps up our tour today of Fairfield Equine Associates. I want to thank you all for joining me. I hope that it was informative and I hope you learned something. We're very proud of our facility here and what we do, and we love taking care of your horses. Have a great day.